Good afternoon, everyone, and thank you for attending today's webinar. My name is Claire Barton, and I will be your host. This webinar is brought to you by the Chartered Governance Institute of Canada, the only global qualifying organization in Canada where you can become a chartered governance professional. For further information about our programs, memberships, and upcoming events, I invite you to visit our website at www.cgiofcanada.ca. Today's webinar is entitled Beyond the Rhetoric, Leading with Intentional Inclusion in Today's Healthcare Workforce. Our guest speaker is Nathan Banda. Nathan is the Director of Surgical Services at the Grande Prairie Regional Hospital and the Queen Elizabeth II Ambulatory Care Center in Alberta Health Services. He is a member of several clinical strategic networks, Alberta Health Services Talent Supply Working Group, and a senior operations leader on the Provincial Diversity and Inclusion Council. Nathan's doctorate research is entitled Factors That Affect Nurse Retention in Rural Canada, Managing Nursing Shortages in Rural Alberta. Nathan's presentation reflects his passion for diversity and inclusion, and we are very pleased to have him here with us today. Before we begin our presentation, please note that everyone has been muted, but if you have any questions, please feel free to enter them in the chat line below. And with that being said, I will now turn things over to our guest speaker, Nathan Banda.
Thank you very much, Claire, for that introduction and your kind words. Indeed, my name is Nathan Banda. I would like to welcome all of you to this webinar presentation, which is entitled Beyond the Rhetoric, Leading with Intentional Inclusion in Healthcare Workplace. There is no one among us who is not touched directly or indirectly by healthcare delivery. And as such, it is important to have a dialogue on issues that optimize recruitment and retention efforts, including diversity, equity, and inclusion in our workspaces, especially in today's healthcare environment that is becoming more and more diverse each passing day. I would like to begin this presentation with a land acknowledgement. As an immigrant in Grande Prairie, Alberta, Canada, I would like to acknowledge the Beaver, the Cree, the Diné, and the Métis people as the original caretakers of these lands and surrounding areas. We are grateful to live, learn, work, and play on Treaty A territory within Turtle Island, and acknowledge these lands have been home to diverse and sovereign First Nations and Inuit nations since time immemorial. I would also like to acknowledge the mistakes and the harms that have been committed against the peoples of these lands. And I commit, alongside many people, to moving forward in a spirit of partnership and reconciliation. Again, thank you, Claire, and thank you, the Chartered Governance Institute of Canada, for providing me this platform to present one of the important topics in diversity, equity, and inclusion. I'm also very thankful to Dr. William Holden of Royal Roads University, who invited me into this space in the very first place. It is truly an honor, and I'm happy to share this webinar session with all of you attending today, and also those that will be attending in the future. Let me begin by introducing who I am by positionality, as well as my ontological assumptions to set the social and cultural context that shapes my worldview in relation to inclusive issues in the workplace and healthcare delivery in general, but most importantly here in North America with a particular focus on Canada and the United States. Let me say here that my lived experiences and values are the pillars on which this presentation is built. So in this presentation, I will go through a theoretical background, the key concepts on inclusive leadership, the traits of inclusive leaders, and we'll do some reality checks in the process. And then you will talk about how minorities are missing as we go up the chain and have recommendations. I'll be concluding this webinar by sharing a personal testimony and then perhaps have a call to action at the very end And you also have a chance to ask any questions, any comments you may have at the very, very end of the presentation. So at the end of this presentation, I hope you have an increased awareness on inclusive leadership issues in the workplace. I also hope that at least we will know what SPEC stands for. This is the acronym I've coined. And I also hope you'll be able to identify at least 4 traits of inclusive leaders and perhaps become one of them. And I would like us to make sure that also that we talk about the disparity between the rhetoric in today's workspace when it comes to issues of inclusion and diversity, and also the actions, the actual deeds on the grounds in our workspaces. Finally, I would like you to take home some takeaways in your practice and again in your leadership. So let me begin by sharing my positionality and also my ontological assumptions. I am an immigrant. I was born and raised in Malawi, Southern Africa. I have lived in South Africa and the United States, and now live in Alberta, Canada. I started my career in nursing in Minnesota in the early 2000s as a healthcare aide, and I practiced as a practical nurse from 2004 before I completed my registered nursing program a few years later. I have worked as a frontline nurse in long-term care, in rehabilitation, in hospice and palliative care. I've also worked in emergency room and in medical surgical departments as a frontline nurse. In 2016, about 8 years ago, after I finished my postgraduate studies in nursing education and leadership, I transitioned into management in acute care management, then in the OR management, and finally, site management portfolio in Central Alberta, before I transitioned even further to my current role as Director of Surgical Services at the Regional Hospital in Alberta Health Services here in the Grand Prairie. My experiences both as a minority nurse and a leader frame my social and cultural context. Let me also state here that my positionality as a nurse who has journeyed through all levels of nursing career, from a healthcare aide position through practical nursing and registered nursing level, and the various levels of management and leadership in diverse settings and geographical settings in North America, including the US and Canada, has aided me in gaining more insights into issues of diversity and inclusion experienced in the healthcare workspaces at different levels. Let me acknowledge that because of my background and who I am by training and social location, I might have a potential bias and subjectivity. Yet, on the other hand, that knowledge, that experience that I bring is invaluable in the narrative of a diverse and inclusive healthcare workspace. Let's talk about inclusion. What do we know about inclusion? How important is it? Inclusive leadership is a quickly developing field. There have been lots of studies since 2010 connecting inclusive leadership and with recruitment and retention studies. Inclusive leadership goes beyond just supporting individuals. It is also about supporting organizations. But for the purposes of this webinar, I will highlight and focus more on what is in literature, but most importantly, the lived experiences as well. Let me start by doing a check-in, a knowledge check-in with those of you attending this webinar today. So I would like to ask the question, when was the concept of inclusive leadership first introduced? I do have 4 answers on the slide, and please, you can come off mute to pick an answer, or you can just put the answer in the chat. Clara, you can help me. If anyone puts the answer in the chat, you can help me just to let me know what answers people are putting in. And for those who are able to come off mute, please stay with me. Just come off mute and tell me what you think and when you think inclusive leadership was introduced as a concept.
You're getting a real mix.
All right. Can you shout out the answers that are coming through?
There's a lot of D's.
A lot of D's, okay.
A lot of D's.
And no one in the group is brave enough to speak out? We have a lot of Ds. Where do we have?
There's some Bs coming in.
Yes, coming in. Okay. So B is 2021. Okay. So 2021, 2018. Okay. Without further waiting, it was in 2006 when the concept of inclusive leadership was first introduced. And this is cited by Nebert and Edmondson in the 2006 article. So it was about 17 years ago when the concept was first introduced. So I think even if you didn't know anything about this concept, you know now that it has been a concept that has been in existence for the last 17 years. All right. So when it was first introduced, the definition of inclusive leadership read words and deeds by a leader or leaders that indicate an invitation and appreciation for others' contribution. So that's where it stopped. From the initial definition, inclusive leadership rested on two key things, namely words and deeds by leaders. All of us attending today, we have heard in one form or the other that words matter, words create, and words can kill also. Let me add that words of a leader matter even more. But the second, to me, in this definition is even more important, deeds or actions. Inclusive leadership recognizes that our words and actions should be inviting and appreciate the contribution of the other. It was 4 years later when there was that added phrase, a development of leaders who exhibit visibility, accessibility, availability in the interactions with their followers. I'll talk about that in a few moments. So what are the concepts in inclusive leadership? So we have some timelines. When it was first developed in 2006, and initially it was resting on the words and deeds and the need for uniqueness, needs for employees' uniqueness and belongingness to be fostered in the workplace. This concept birthed from optimal distinctiveness theory in 1991. So this theory suggested that we are unique as individuals. And because we are unique as individuals, it's very important for leaders to really make sure that we remember that everybody comes in the workplace differently from the other. In 2010, as I said, there was that additional layer of the leader's visibility, accessibility, and availability in their interaction with their followers. So beyond just the focus on words and the deeds, but ensuring that leaders are visible, accessible, and available as they interact with their followers was another focus that was added later on 4 years after the concept was developed. In 2018, there was another added dimension to inclusive leadership, and that was the need for leaders to ensure that there is justice, there is equity in providing shared decision-making opportunities to their followers or to the people who report to them. And since 2021, 2 years ago, or about 3 years ago now, to date, the focus has been more on giving leaders the tools to support inclusion in their workplaces. So there is still a lot of stuff going on behind the scenes and in research in terms of inclusive leadership. Let me submit that inclusive studies intersect diversity management studies and also leadership studies. So there is an intersection of both two schools of thought, diversity management on the other and leadership studies on the other. For this presentation, let's focus on employee level, team level, and finally, organizational level. So again, in that slide, I just show you the timelines from 1991 to date. Let's look at the foundational concepts in inclusive leadership. So there are 4 concepts. Number 1 is fostering uniqueness of employees. The second is appreciation of employees. And the third is strengthening belongingness in a team. And finally, is supporting organizational efforts. I'll go through each one of these concepts in the next few slides. I've coined this acronym SPEC. So for you to remember this, as you may remember that it was one of the things I put on the outcomes expected out of this presentation. I've coined this acronym SPEC, standing for support, promote, empower, and contribute. If you forget everything I say, if you can just remember those four letters, SPEC or special, support, promoting, empowering, and contributing. So how do we support employees' uniqueness in the workspace? So rather than striving to change employees when they come into the workspaces, inclusive leadership strives to ensure or challenges us to ensure that we get to know the employee right from the entry point in the workplace. And secondly, leaders need to be present and concerned about the employees' feelings, expectations, as well as interests from the very get-go. P, promoting. We need to recognize and embrace the employees' individual differences they bring to the table. As such, we need to be open to diverse opinions and ways of doing things. And we need to give an ear to employees' ideas and be slow to dismiss new ideas when they come. We are very used to, we are accustomed to our ways of doing things. We don't want, we are creatures of habit. So it's important, before you dismiss something else, to really give an ear and give some space to new ideas of doing, especially when it comes to inclusive leadership. We also need to be able to ask and help employees contribute. Sometimes when you see your employees be very silent, it's time to step in and ask them to contribute, ask for their voices. And that segues into empowering employees, the E. New employees, mostly the visible minorities, will be most often will be very slow to engage and warm up. They are not very sure of themselves as they come into your workspace. They don't know how they'll fit in. So we need to encourage them to become involved in unit and organizational efforts. We also need to promote spaces where such employees can share their ideas on what has worked for them in the past or where they come from. Finally, the C. We need to explore the professional needs and growth opportunities for employees. Specifically, we need to seek growth opportunities to help employees advance their career prospects. We need to check in with our employees regularly and provide feedback to them. And feedback should be bi-directional. We need to provide feedback, but at the same time, be willing to receive feedback on how we're doing. And finally, we need to offer advice and guide our employees when mistakes are made. We need to offer opportunities even for second chances. One of the things which happens with employees when they come into the workforce is the question they will ask, do I belong? And this question, do I belong, the issue of belongingness rests on a triple stand: equity, relationships, and shared decision-making. So how should we ensure that there is equity in our workspaces? We need to ensure that the communication with all employees is unbiased. We need to ensure that rewards are distributed fairly. And also we need to ensure that everyone is fairly represented, particularly at the decision-making table. Most often, our decision-making tables comprise not of a representative workforce. This is where things are lost. We need to ensure that there is that representation if we are to get the most out of our employees. Relationship building. We need to foster a relationship building environment for us to have an effective functioning working environment despite the diversities we have in our workforce. We need to support employees as team members. This initiative will make them to be co-owners of the initiatives we have in our team. We need to make the members feel they belong and they matter. How do we do things? One of the simplest examples would be when our employees go on vacation, they've been missing or they are sick, they've been away for some time. When they come back, we need to make an intentional effort to show them that they do count and we value them, and we did miss them when they were away from our environment. Then finally, on issue of belongingness, there is shared decision-making to ensure that there is a transparent work environment where everybody is thriving. Whenever and wherever possible, we need to consult a team as needed before decisions are made to build consensus. Now, I do know working in the healthcare environment that there are times when leaders, we have to make decisions without consultation, without consensus building. In such instances, inclusive leadership calls for leaders to provide reasoning for taking such a step, such a step or such a stand. In that way, we will ensure that we have a transparent and trusting work environment. One of the questions employees will often ask is, am I appreciated? How often do employees' hard work make it in the headlines? Do they get recognized? Are they appreciated? Often leadership is present when there is a concern or an issue to be resolved, what I call in this webinar as a headmaster's or principal syndrome, such that when the leaders come on the unit, people are afraid because something is wrong. Inclusive leadership notices efforts and encourages that we affirm contributions of individuals and we praise their achievements. And leaders are not principals, leaders are not headmasters, but leaders are colleagues that are missed when they don't show up. Leaders are colleagues who employees should be looking forward to meeting them rather than fearing them, rather than shunning them when they come to the units. And finally, on the concepts, supporting of organizational efforts, knowing that organizations are always changing, inclusive leadership calls for leaders to be flexible and ready to adapt to the changing needs of their workspaces and organizations. Leaders need always to pay attention to new opportunities when they arise and new ways of doing business. Inclusive leadership requires leaders to understand and engage with all players, including those who may be resisting the wind of change. There shall always be those who are either slow or resist the wind of change. Yet, inclusive leadership calls for me to respect them and to include them regardless of their positions when change is taking place. More importantly, inclusive leadership calls for a creation of safe spaces where everyone can be heard and can be respected. Let me propose to you as leaders attending this webinar today that always be mindful of relating how your inclusive activities relate to the mission and the vision of the organization where you're part of. So let's do another quick check-in here. We've spent about 20 minutes into this session. Let's do another check-in. Would you please be able to name at least 4 traits of inclusive leaders? We've talked about the concept of inclusive leadership. Let's talk about the leaders themselves. What are their 4 traits? And then you can put your answers in the chat, or you can come off mute and maybe give us 1 or 2 if you do have any. And then the second question is, according to you attending today, which traits are the most important in inclusive leadership? I cited 4 of them there. You can rank them according to your ranking. And again, you can put that in the chat, or you can come off mute and tell us what you think. And Clara, you can shout out what's happening in the chat.
Okay. Empathy is 1.
And please, as Sarah is looking through the chats, you can come off mute. Please don't be shy. You can come off mute and tell us what you think are the traits of inclusive leaders.
We have here open-mindedness. Okay. 1 comment, I think our leaders bias, awareness, supportiveness, emotional intelligence, authenticity, welcoming and accountability, collaboration, good listening skills. We have supportive, confident, respectful, fun, active listening, respect, non-judgmental, and compassion. Transparency.
All right, that's good. Hey, I can see that I have my leaders also who have joined this webinar, so I'm very happy for my leaders attending this webinar also. They didn't expect that if they attend, I may put them on the spot, but I will. So please, my apologies in advance. Don't fire me when I do that. Stacy Greening, tell me what you think is the most important trait of inclusive leaders.
Yeah, I think it's the active listening and holding space for perspectives that may not be your own. And I'm happy to be put on the spot, Nathan. Thank you.
Thank you. Tsegai, what do you think would be the most important trait for inclusive leaders?
Not holding firmly to your truth.
Not holding firmly to your truth. Thank you.
Get it very wrong. So include other people's perspectives, even when you feel you're right.
All right. Thank you. Thank you so much. So I will go through 10 traits that are the most important of inclusive leaders. They are not ranked according to their priority, although I think that the number one is number one. Let us go quickly through that in the next few slides, in the next slide here. So these are the 10. There is bias awareness, equality, active listening, and you mentioned most of these: being curious, constructive feedback, effective communication, being empathetic and compassionate, creativity, teamwork, and cultural knowledge. Let me quickly go through this in respect of time. Inclusive leaders should be more aware of their own biases and preferences. I think this is where it starts. You really have to know who you are. What are my biases? What are my preferences? And then because of that, let's rely on diverse opinions from different backgrounds to limit our own biases and blind spots. Rather than limiting diverse opinions, we should actively encourage and listen to diverse ideas and ways of thinking. When it comes to equality, inclusive leaders promote equality in the workplace and make this a priority in the business decisions and relationships. Promotion of equality includes being inclusive in hiring practices and helping employees reach their full potential. Then when it comes to active listening, which was mentioned, which was highlighted, it's important to focus on active listening so that we gain input and ideas from all involved in our workplace. And then the one I love even the most is being curious. Inclusive leaders should motivate and encourage teams to be curious, encourage innovation and new ways of doing business, new ways of looking at things. And constructive feedback, as I touched on earlier on, should be feedback that is not only one directional, but bi-directional. Feedback to your teams, as well as getting feedback from your team on how you're doing. Effective communication. More than actively listening and more than providing feedback, leaders should have the ability to initiate discussions during meetings and highlight important points while welcoming inputs, however diverse they may be, from their team members. Leaders need to be empathetic and actively seek to understand others' perspectives, feelings, and ideas. Such an attribute makes leaders to remain flexible to the needs of all their team players. Leaders need to be creative and allow others to provide unique and innovative ideas. And then the last two, teamwork is central to inclusive leaders, collaboration, and working with others, including ability to lead them, to delegate where need be, and also direct the teams as necessary. The final one, which I would like to leave you with, is inclusive leaders need to have a trait of and be sensitive to the team's cultural diversity and to finding ways of adapting, embracing the diversity in the workplace. Inclusive leaders need to be sensitive on who do they have and need to strive to really understand the cultural diversity within their team so that they can find ways of adapting and embracing to the trends within their teams. So what are the key steps in intentional inclusive leadership? So hiring is the very first place to start inclusive leadership discussion. Ensure that you are aware of your own potential biases in shortlisting potential hires. I would advocate for blind shortlisting of candidates, especially when it comes to position of influence. Ensure that the panel is as diverse as it can possibly be. And then after hiring, it is now time to use the spec as we went through it earlier on. Support and mentor members, especially those who might be disadvantaged or coming from visible minority backgrounds. Identify frontline individual employees, including minority employees with upward mobility potential, and intentionally engage and connect with them on possible leadership spaces in your workspace. So, why is it important in healthcare workplace to have inclusive leadership? It brings out the best of individuals in terms of both productivity and quality, as individuals feel accepted, respected, and they feel a sense of belonging to the workplace they are part of. And by increasing a sense of belongingness, a sense of the other is diminished in any workplace, including in the healthcare workplace. This in turn increases retention and diminishes the intention to leave by visible minorities in the workplace. And more importantly, inclusive leadership is the best way to render best possible care to our diverse patient populations and improve the overall patient care outcomes and experiences in the healthcare settings. As a leadership team that is representative of the diverse populations not only challenges the perceived norms in a predominantly colonial structured work environment that favors one group over the other, but also inspires all practitioners, including minorities, to produce the best of themselves. In doing so, we bring out the best of each and everyone in our workspaces. Let's do a reality check on inclusiveness or inclusivity in our workspaces. As I noted at the beginning, talk starts first and sometimes can be cheap. Actions or deeds are the ones which take long to take hold. Today, many organizations are celebrating the titles, the most inclusive employer, the best inclusive employer, the most diverse employer. But what is the reality on the ground where it matters most? How are we doing in terms of inclusivity in the workplace? Such a discussion will take hours and hours to complete. I will, in the next few minutes, scratch the very surface and hopefully leave you with a few takeaways. For the last 16 years, 100 employers are selected as winners in the Canada's Best Diversity Employers competition. And any employer with a head office or principal place of business within Canada may apply for this competition, whether private or public. And detailed reasons for selection of winners are provided and co-published with the Globe and Mail every year. I work for Better Health Services, an organization that has been recognized in the competition as one of Canada's best diversity and inclusion employers, an achievement that should be celebrated. There are also several banks, several universities recognized for their efforts as well. What is great is that the list is not the same year in, year out. These are the steps in the right direction in ensuring that our workspaces are not only diverse, but inclusive as well. Yet, there remain myths about minorities in leadership. Five myths I would like to share with you. It is thought that being a minority leader in an organization is considered as a position that you're favored in and you haven't earned it. Individuals who are visible minorities do not have the competencies to be in leadership position despite their qualification they may possess. Again, that's another myth. Then the third myth is that the qualifications of minorities may have been, they may be fake. They may have been manufactured, if at all they have any. So because of this, their qualifications normally are questioned. And fourthly, another myth, having minority leaders will bring down the performance or quality of the work we do in an organization. And having one or two minority persons is sufficient and meets the public image of an organization that promotes inclusivity in the workplace. That's another myth. I did a quick environmental scan in our healthcare workspace in Canada. In this quick environmental scan, we have the following summary. Leaders are to intentionally provide all employees equal opportunities to succeed by ensuring that they get to know the employees' needs, and particularly the needs of the visible minorities who might not have enough support in the first place. Leaders must also intentionally increase their own awareness and of the obvious and invisible obstacles minorities may face right from the hiring throughout their journey in the workplace. Leaders must take the proactive steps and measures to support all members of their teams against the pushback and skepticism their well-intended efforts may attract. Leaders should actively detect practices that promote exclusion and discrimination of certain groups of people and replace them with new practices that are representative of all. Leaders must ensure a workplace that encourages a spirit of inquiry and questioning without being defensive and without dismissing new ideas. Leaders must ensure that each employee is not only welcome, but respected for who they are. Leaders must be vulnerable enough to acknowledge their own flaws without shame. Leaders should create an environment where questions and diverse opinions are invited and discussed without prejudice. While we have made advances in healthcare, people are living longer, we're able to cure diseases which couldn't be cured in the past. One thing we've not been able to do is to produce enough professionals to meet our growing healthcare demands our population need. The good news is that the developed world, including Canada and the US, remain an attraction to the internationally educated professionals, including nurses, doctors, and other healthcare professionals. And we are able to get the cream from all over the world, including in terms of their academic qualifications and sometimes their experiences as well. There is a corresponding diversity in the workplace than before. Today, we have professionals from the Philippines, from India, the Caribbean, from Africa, and South America, and other parts of the world as well, mostly in our healthcare workforce. What are the common themes we've seen in our workspaces? We can take note that there is increased diversity. That is seen more at entry-level positions, the front lines. The trends we see in Canada are replicated in other developed countries, including Australia, New Zealand, the United Kingdom, and the US. Notably, this increasing diversity is not being seen as we start going beyond the entry-level frontline position. This is where the rhetoric on diversity and inclusion becomes questionable in our workspaces. It should be noted that inclusion has been a challenge in our system from times immemorial, either related to our colonial past or paternalistic history. It's not lost out on me that women were only able to cast their ballot in 1920. And it was only in 1956 that segregation on city buses in the US was deemed unconstitutional. Such histories in the developed world have favored some people over the other naturally in positions of influence. It appears that it is easy to welcome visible minorities in entry-level positions, the internationally educated people in those entry-level positions, but it's not the same when it comes to the positions of influence, despite the qualifications such people may bring to the table. According to Toronto Region Immigrant Employment Council, TRIEC, although employers are showing more willingness to hire skilled immigrants and visible minorities, employers are reluctant to consider immigrants for leadership roles. And I quote, "Yes, there is willingness to hire minorities. The willingness, although it is there, but when you get to management, senior management, executive level positions, immigrants are not seen as a talent force," according to TRIEC. The report further says that there is absolutely no doubt that the leadership profile in Canada looks remarkably homogeneous. According to Pamela Jeffrey, the founder of Canadian Board Diversity Council, she states that according to a survey that was done in 2015 in Canada, visible minorities made up just 7.5% of the board seats at the FP 500 companies in Canada. And not only were visible minorities missing on the boards, but they were also not in the pipeline to be on boards because they are severely underrepresented at the executive level, she says. This is where the rhetoric and the accolades on diversity and inclusion are not enough. In fact, the rhetoric and accolades institutions get can be deceptive and paint a picture that we are doing enough or we are doing more than enough in the diversity and inclusive workspace, yet enough is not being done. Intentional inclusion is not only a recruitment and retention issue, it is also an issue of integrity. It is also an issue of human rights to all people, as we claim all people are equal and deserve equal opportunities in the workspaces. Let me talk about a study that was done in Australia. And this study is published by Adamovic and his colleagues. In this study, which is entitled Glass Ceiling for Visible Minorities. Again, this study was done from studies in Australia and New Zealand. 26.8% of job applicants with English-sounding names received positive responses, and only 11.4% of those with non-English-sounding names received positive responses. The study findings suggest that there is ethnic discrimination in the recruitment, particularly in leadership positions. The study also finds that the level of ethnic discrimination is more pronounced when you come to leadership positions than in non-leadership positions. The study concludes that ethnic discrimination in leadership positions is an important factor why we have the lack of visible minority as we go up the chain. Now, one may say that's a study in Australia and New Zealand. Where are we doing? What about the US? What about Canada? What about the UK? The chief Andoropoulos in 2016 wrote this article in the studies that were done in Canada. Matthew, but not Samir, new evidence from Toronto, Montreal, and Vancouver. This two-year study in 3 major cities of Canada was revealing in the barriers faced by individuals with racialized sounding names right from the entry point in the workplace. This study is a wake-up call for organizations to go beyond the rhetoric and take intentional steps in the journey towards an inclusive workspace. The study concluded that minority applicants have less chances of getting shortlisted in the first place, and even in organizations that purport to support diversity and inclusion, minority applicants may have very slim chances of being shortlisted. Just like in the Australian studies, this is an area that needs renewed focus and attention if the workplace is to truly be inclusive. According to the US Census Population Bureau, in 2020, before I go to the US Population Bureau, let me go to another study, another article by Sarah Dobson. Sarah Dobson of Toronto Region Immigrant Council reports that there are barriers visible minorities have, and these barriers are the same as the barriers women have been facing in a long time. Employers think that such individuals do not have expertise to lead or manage entities. She further notes that it's biases like these that often have impact in terms of immigrants getting hired, because employers think they will be taking a risk if they hire minorities in positions of influence. If they hire minorities in positions that are higher, that require a lot of leading. And the more the concern, the more they are willing not to go outside of their comfort zone. Inclusive leadership calls for employers or decision makers to get out of their comfort zone, to challenge themselves and be comfortable to be uncomfortable. And at times, to take risks and give individuals that may not be considered for positions of influence a chance, and where possible, plan even on investing in them. According to US Population Bureau, in 2020, the US population has 57.8%. Again, that's 2020 Caucasians. And then for the 2.2% of the visual minorities, that includes the Hispanics at 18%, Blacks at 12%, and Asian at 11.4%. This is a big growth from where it was in 2010, where the population of Caucasians was 64%, about 64%, and about a third of the population was the visual minorities. So you can see there's been a significant and dramatic growth in the visual minorities in the US. In fact, the Hispanics and Latino population has grown substantially within the last decade in the US. Now keep those stats with you, 57.8 Caucasian, and for the 2.2% of the other races. When you go into the workforce in the US, at entry-level positions, you find that 64% is Caucasian or white, and 36% is visible minority. What does that mean? That means that there is overrepresentation of Caucasian white individuals at the entry-level positions in relative to the actual population, which is about 57.8%. Now, although that may show that it's overrepresentation at that level, it is at that level, at the ground level, entry-level positions, where at least the populations, the demographics mimic the actual populations in the community. As you go up the chain, you will discover that there is a diminishing number of individuals from the other races or visual minorities. As you're going to the executive levels, in 2020 census in the US, you find that only 15% are visual minorities, with the blacks having 2%, the Hispanics 3%, and the other races sharing about 6% of that. Now, when you compare with the 42%, there is no representation at all. So as you're going up the pyramid, you discover that visual minorities are missing in the chain. Now, one may think this is on the other side of Canadian border. It's not true for Canada. According to StatsCan last year in 2023, they agreed with this observation that it's the same observation even within the Canadian setting. In fact, Stats Canada adds that the racialized Canadians are less likely to find leadership jobs and good jobs than their non-racialized or non-Indigenous Canadians, despite their education, which often is higher in the workforce they are in. So having gone through these examples, what recommendations do I bring to the table? So what must leaders do to improve the quality of care despite the disparities that exist where we are working? Leaders must intentionally make efforts to support and mentor visual minorities to increase their upward mobility as they continue to move up the chain. And by intentionally creating workspaces that are supportive and inclusive, retention of visual minorities will be enhanced and increased, and the upward mobility in the leadership chain can be increased as well. Leaders must intentionally create safe and respectful workplaces by intentionally inviting and engaging employees, including those from visual minorities. Leaders must make efforts and provide mentorship to increase the potential in their workplaces. I would just like to wrap up this conversation with my personal testimony. In 1998, I had just left Malawi. I was in South Africa. I am a person of faith. I go to church every Saturday, Sabbath. So I had just taken my seat in the church one Sabbath morning in Pretoria, the capital of South Africa. That was in December of 1998, when a middle-aged woman approached me and directed me, "Your church is on the other side of town." She proceeded to give me directions. She was politely telling me that I didn't belong, that I was Black and not welcome in her church. I was supposed to leave and go to another church that would welcome me. I realized that I could not see anyone in the church who looked like me. That was my wake-up call to issues of racism and exclusion, including in the faith community. A few years later, in rural Minnesota, as I worked as on a unit as a healthcare aide in early 2000s, a woman resident in her 80s one day called and asked me, Nathan, since when have you guys started caring for people? When I further probed her, what she meant was that as Blacks, we belong to housekeeping and the kitchen, and we do not belong to those colleagues who could provide personal care or nursing care. And people in this case meant Caucasians. So as Blacks, we are not supposed to provide care to people. Such a question was so troubling for me. Yet I thought that perhaps this woman was innocently speaking and asking because of her history. It had never been expected that Blacks would be competent enough to provide personal care. It was not uncommon for families to avoid me when I had information about their beloved ones. They would rather go to someone else who looked different from me. What was more piercing was the rejection even by my own colleagues in the healthcare workspace on the front lines along the way. At school, I would be the last one to find a peer to work with for group assignments. Having relocated to Alberta, Canada in 2009, and knowing that Canada prides itself as a multicultural community, I was naive enough to think that the issues of racism and exclusion I had experienced in my past life would be history. I was excited to be welcomed in a team that practiced team nursing. I recall one of the nurses who each time she was working alongside me would insist that we divide the patients between us and our assignments. I quickly learned that she would only do this when she was working with me, and when she worked with everybody else, she would continue to practice team nursing. She never trusted that a Black person would do the job well enough. So as such, it was better for me to have my own assignment and her to have her own assignment. She couldn't partner with me. That was another wake-up call. And later on in 2016, when I passed over, in 2016, when I was passed over for a role in leadership after I had done my graduate studies, that seemed that the role that had seemed naturally to be mine to lose, it was another wake-up call. I would later on be told that I did so well in the interviews, but I did not have managerial experience. Yet the purported successful applicant did not possess any managerial experience, but she was qualified and she was successful. 5 years later down the line, I could not even make it on the shortlist for multiple roles in leadership, despite my qualifications and experiences that I bring to the table. I wish I would say this is the one-off story, but it is not. It is one of the many stories visible minorities face and share. If I were to end my story here, it would be dark and doom. It would be a hopeless story. While I have met these barriers in my journey, I have also met wonderful and some great champions who have stood by me and lifted me up when the weight of frustration and discouragement was so high, when the weight of exclusion was taking a toll on me. I have met allies who have been and continue to be my champions along the way. I have been mentored and supported along the way. The champions have been my inspiration and role models in inclusive leadership. Walt Disney says the way to get started is to quit talking and begin doing. Time for theory is past. There have been many speeches, there have been many celebrations. The rhetoric has been great, but there is more work that must be done. I would like to submit to you to intentionally be an ally in inclusive leadership. Embrace diversity as the beginning of accepting all peoples for who they are as individuals. Inclusive leadership is about valuing individuals. It is about valuing the individuality they bring to the table. It is about ensuring a safe and respectful workspace that gets the most from each one of us, despite the different lens through which we view the world. Let me end up by assigning you a simple test when you get out of this webinar. I want you to go to Walmart today, look and walk around in the store. Then go back to your workplace, look and walk around. If you can replicate the demographics you saw in Walmart in your teams, including beyond entry levels, then you are doing very well. But if you are not able to see the same representation, the same demographics you saw in Walmart beyond your entry level positions, then you still have a long way before you can call your place diverse and inclusive enough. In conclusion, I would like to submit that although there have been a growing rhetoric on diversity, equity, and inclusion, there remains a huge disparity between the rhetoric and the deeds on inclusive initiatives, both in academia and the industry, including healthcare workspaces. There is more diversity and inclusivity at entry-level positions, but the same is not being replicated up the chain. Studies from several countries, including Canada, show that there is a lack of appetite for leaders to invest in visible minorities, in mentorship programs and new opportunities that might be available in the workspace for leadership positions. Friends and colleagues, in a world where recruitment and retention is a challenge, inclusion is not only one of the foundations in building a sustainable and respectful workplace, it is also the way to get the most and the best in today's diverse teams in healthcare delivery. Thank you. At this time, I will hand over to Claire if we could have some questions or comments to take. I would gladly do that.
Are there any questions there? I'm seeing a lot of comments in the chat line, a lot of experiences. Yes, it was an excellent presentation. Does anyone have any questions for Nathan? William?
Good morning, and thank you, Nathan, for the presentation. I'm sorry I was a little bit late as I was attending a meeting just earlier than this presentation. Can you hear me by any chance?
Yes, we can hear you very well.
Thank you. I was just looking at it from the perspective of power. Apparently, a lot of stuff has been happening in society. What you're talking about in terms of diversity, equity, and inclusion are in a way microcosmic, because this is talking about individual organizations and individuals. But societally, there's also a bit of a struggle, power struggle between those that are already in position of authority or in power, and those who are not. And that's why, you know, we are advocating, oh, give the other people a chance, etc. And of course, there will be fightbacks, like the conspiracy theory, like the great replacement theory, plus the gunmen's, etc. You know, there are lots of pushbacks. And of course, in the political movement, we have also observed a lot of, oh, let's not talk about this, or yada, yada, right? So as you're trying to promote this, some people will see that you're threatening their throne. How do you counter this? Because all you're doing is advocating. But when those who are in power to make that change feel threatened and feel fighting back, it becomes open war. Thank you.
No, thank you very much, William, for your question. I think that's a very good question. And I think that's why in my presentation, I'm entitling this intentional inclusive leadership. We have to have intention. As I said in the presentation, our colonial history, our paternalistic history has not helped us, because it's a history that has been built on colonial structures and on supremacy, that one race, one group of people is superior than the other. That's where we come from. That's why we really have to take some intentionality to manage this. Is it an easy fight? No. As we say, there is pushback. There is replacement theory going on out there. There are people being threatened, and they say we are losing out. We should get back. As diversity increases, there is more threat and more fear to the established structures. Yet, diversity, for us to be as productive and for us to gain the most out of everyone we need to go beyond that fear. And that's why this presentation is more for leaders, because we have an influence. We have a chance to make a difference in our workspaces. This is happening in academia. It's happening in the industry. It's happening in all the countries where we have issues of diversity. I think I can see Denise, and then after that, I'll go to Paul. Denise.
Well, that was amazing. Thank you, Nathan. I just wonder if this presentation also reaches the audience, like what audience do you deliver this to as well? Because, you know, I think it's so important as leaders to really have and be aware of this. And in every, I mean, you look at the fire, if the fire truck comes, there's never any I've never seen a Black fireman or a fireman of color. So it's across all organization where this inclusiveness, and I think it's a lot of undiagnosed biases that exist, that keep us in these levels. Such a presentation like this would really be good for leaders in our organization to really actually attend and be aware of some of these things. Really good.
Thank you very much, Dennis, for that. And you are right on. That's why when I was looking at traits of inclusive leaders, one of the very first thing was our awareness of our own biases, because we have affinity towards what we know, towards who we know, and sometimes unconsciously we are doing that without knowing that that's exactly what we're doing. So I agree with you that this is one of the presentations which should be shared even more. It's the first time I'm making this presentation, but I think there could potentially be a few other opportunities. As I say, this doesn't only apply to the healthcare workspace, it's across the board. As the example I gave in the US, the demographics, you see it's everywhere, both in academia as well as in the industry. And I do work in healthcare where I see it all the time that on the base of the pyramid, you have everybody else. But as you're going up the chain, minorities start missing in the chain. And some other industries that you've said, we have people missing completely. You don't have representation at all. You talked of the fire people. Someone has talked to me about EMS, that it's rare to find other colors within the EMS department, which is astonishing that although we have so many colors elsewhere, we are failing to have all those colors represented in the force. So very wonderful addition, Denise. Paul, I saw you had a hand up.
Yes, thanks, Nathan. This is a very good presentation. You proved me right. That's why I brought my friend Emily from UK. Welcome, Emily. The thing is, what I see is there's a lot of fear, and the fear is the growth. Because when we are inclusive, we grow. Look at it as an apple pie. The more ingredients you add, the more it grows and the better it becomes. People are scared, they shouldn't be. What touched me about your presentation is that there is a lot of when people fear like that, it's not because they think that we're going to take their jobs or anything like that, but it's because they think that they're going to be replaced. No, we'll be working together. So it's inclusivity of everybody to work together and provide the services. Unfortunately, it's not just in the healthcare system, it's also in the government. I'm in Ottawa myself, and that's exactly what we're dealing with. People are fearful of including others because they think that they're going to be replaced. Nobody is replacing anybody. We're just encouraging people to work together. So I just wanted to thank you for that. Beautiful. Thank you so much.
And thank you so much. Before I hand it over to Claire, I would say that the pie is large enough for all of us to eat here. In fact, we are still short of the needs for us to move forward, whether it's in the industry or in academia. The pie is large enough. Let's come together in diversity. There is more to gain. The more we have everybody, the more we produce, and the better the workplace, the better the environment, the better the production. Thank you. I think I would hand it over to Claire, and in case there are people with more questions, Claire, you direct how we can handle that.
Yes, Nathan, I believe you did enter your email address in the chat. If anyone would like to speak with Nathan or message him, that would be wonderful. I just want to say again, thank you very much for this excellent presentation. Having come from a healthcare background, I totally appreciate what you've presented today. And I'd like to again thank everyone for joining us. I look forward to seeing everyone at our future CPD webinars, which you can find listed on the CGIC website. And with that, I'd like to wish everyone a wonderful afternoon.